Hello, everyone, and welcome to NUR 410, Nursing Research, Reading, Using, and Creating Evidence. I am your professor, Dr. Marian Johnson. Thank you for all of your participation. I know there's only a few of us, but thank you again. Continue to text me, email me, call me, whatever is convenient for you. So let's get started with week 4. And in this lesson, we will be discussing two key topics: sampling strategies and measurement and data collection. Sampling strategies. No aspect of the research plan is more critical for ensuring the usefulness of a study than the sampling strategy. It will determine whether the results of the study can be applied as evidence and contributes to the trustworthiness of the results. Good sampling is critical for the confident application of the study findings to other people, settings, or time periods. Samples are drawn to represent populations in a research study. A population, sometimes called the target population, is the entire set of subjects who are of interest to the researcher. It is rarely possible or even necessary to study the entire population of interest. It is more likely that the researcher will study a subset of the population called a sample. Samples, if selected carefully, can represent the population. Because samples are more efficient and economical to study, their use enables researchers to study phenomena which, when reaching the entire population, would be impossible. Population, the entire set of subjects that are of interest to the researcher. Sample, a carefully selected subset of the population that reflects the composition of that population. Sampling has a downside, however. Measures acquired from a sample cannot be as precise and accurate as those drawn from the entire population. The results from a sample will never match the population perfectly. Researchers use statistics to measure and account for this difference, resulting in a value called sampling error. Sampling error is a critical consideration in statistical testing, sometimes referred to as chance or standard error. It is the criterion used to determine whether statistical results are a result of real effects. It is critical, then, to use a selection strategy that minimizes sampling error by maximizing the chance that the sample will represent the population. Sampling error, a number that indicates differences in results found in the sample when compared to the population from which the sample was drawn. The sampling plan is important whether the research is qualitative or quantitative. The plan serves different purposes, however, based on the type of research. In qualitative research, the sampling plan is central to establishing credibility. The individuals who participate in such a study are referred to as informants or respondents and are chosen specifically for their capacity to inform the research question. If the quantitative study, in a quantitative study, the sampling strategy aims to maximize the potential for generalization or the ability to apply the findings to larger groups. The individuals who participate are referred to as subjects and are chosen using methods that ensure the sample adequately represents the overall population. Therefore, the way samples are recruited and selected will determine our overall confidence in the results. The sampling strategy is the primary way that researchers control selection bias. Selection bias occurs when subjects are selected for the study or assigned groups in a way that is not impartial. When subjects are assigned to treatment groups using a random method, however, selection bias is reduced. Selection bias poses a threat to the validity of the study and is controlled almost exclusively by sound sampling strategy. Selection bias. Selecting subjects or assigning them to groups in a way that is not impartial. This type of bias may pose a threat to the validity of the study. No less critical is the sample's capacity to detect the effects of the intervention. Having an adequate number of subjects provides the study with power or the ability to detect effects. Power increases confidence in the results of the study and depends on an adequate sample size. The researcher controls a study's power by ensuring that an adequate number of subjects are represented in the sample. These aspects of research design, the method for selecting subjects and assigning them to groups, and the numbers of subjects studied are the most important considerations in sampling strategy. Nevertheless, the sampling strategy often is given little attention in a research study and may be the weakest aspect of otherwise well-designed projects. Upon assessing the sampling adequacy of all research studies published in a nursing journal over a 7-year period, one researcher found that 32% of the studies used samples that were appropriate for the type of statistical analysis used. This shortcoming may not be a reflection of the skill of the researchers, even when effort is spent to design an effective sampling strategy. Conditions beyond the researcher's control may limit the capacity to apply the sampling strategy as planned. In one study of a nursing intervention in a population of HIV-positive persons, 639 clients were eligible for the study. Despite multiple attempts to recruit subjects, only 43 agreed to participate, and of those, only 16 finished the study. The authors noted the multiple challenges of obtaining adequate samples from this highly marginalized population and concluded that the less rigorous sampling strategies may be the only resource for studying such persons' care. New ideas about sampling, such as service or respondent-driven sampling for hard-to-recruit populations, are also being tested and bring a fresh perspective to the interpretation of generalizable sampling. When reading published research, the sampling strategy is assessed to determine the level of confidence that the results are accurate and potentially valuable to the practice. A sampling strategy that is not representative limits the ability to apply the research results in nursing practice. Creating an adequate sampling strategy requires that the nurse researcher maximize representativeness and sample size. Tongue twister. Creating an adequate sampling strategy requires that the nurse researcher maximize representativeness and sample size. Sorry. This endeavor frequently requires creativity and persistence, but it is critical to ensure that the results can be confidently applied to nursing practice. I need you all to try that tongue twister. Record and send to me for an extra credit point. Okay, selection strategy. How were the subjects chosen? The first step of a sampling strategy is to clearly define the population of interest. Often, this definition begins during development of the research question. The definition should be clear, unambiguous, and detailed enough to avoid misinterpretation. Populations are frequently defined in terms of age, for example, adults, children, and neonates, diagnoses, setting, or geographic location. The available population is called the sampling frame. It comprises the potential participants who meet the definition of the population and are accessible to the researcher. This does not necessarily mean physically accessible. For example, the sampling frame for the population of critical care nurses in acute care might be the membership roster of the American Association of Critical Care Nurses. Sampling frame. The potential participants who meet the definition of the population and are accessible to the researcher. Once the population is clearly defined, a selection strategy is designed to choose the actual subjects from the sampling frame. The selection strategy involves making decisions about how subjects will be recruited, selected, and if appropriate, assigned to the groups. Such decisions are based on the type of study design and the goals of the research. The goal of the selection strategy is to prevent bias, support the validity of the study, and enhance the credibility of the results. All samples may be threatened by selection bias, meaning the sample is not accurate to representation of the population. The divergence may occur for many reasons, some related to design of the study and some related to its execution. Selection bias can occur when a researcher can affect the selection of the study subjects for the study or the assignment of subjects to groups, perhaps resulting in a sample that is biased towards success of the experiment. For example, a researcher may select an intervention group consisting of individuals who are healthy and therefore more likely to improve, and select a group of sicker patients who are unlikely to experience improvement without the same sort of treatment. This bias may be conscious, but it is more commonly unconscious. It is of particular concern when the researcher has preconceived ideas about how the study will turn out. Inadequate sampling can also lead to sampling bias. A biased sample underrepresents or overrepresents some characteristics in the sample. Unfortunately, the samples that are the easiest to recruit may introduce sampling bias into the study. Convenient samples, in particular, run the risk of overrepresenting characteristics that are local to the study. For example, subjects who are recruited primarily from a tertiary care center may inherently include more seriously ill patients. Conversely, recruiting from outpatient settings may underrepresent the severity of a condition. Sampling bias increases sampling error, as well as a chance the researcher will draw misleading conclusions. Even when the researcher has developed a rigorous sampling plan, certain segments of the population may refuse to participate or be unable to participate in the proposed study. Sampling bias may be present when a group is too homogeneous, such that it does not reflect the diversity in a population. A homogeneous sample is one in which the subjects are very similar in terms of their characteristics and it makes generalizing the study results to other populations difficult. Historically, samples for medical research have been heavily weighted with white males. In the past decade, researchers have become more sensitive to the need of a broad representation of ethnic and gender groups in research, but gaps in representation still exist. Another kind of selection bias occurs when subjects elect not to participate. Systematic sampling error can occur when response rates are low or attrition is high. Many reasons explain why subjects may decline to participate in a study or drop out once it has started. A certain amount of refusal or non-response is to be expected in any study. However, the researchers should describe the reasons for refusal or attrition to ensure that systematic sampling error is not exhibited. For example, if all the individuals who refuse to participate for example, if all the individuals who refuse to participate are from a particular ethnic group, socioeconomic status, or educational level, then the final sample will not represent the entire population. Think about strategies that can increase internal validity of an experiment study. Keep that question in mind. Strategies that can increase internal validity of an experimental study. Also, what serves as the basis for the research design? A couple of key questions. Sampling selection strategy. Sip my tea. Okay, sampling selection strategy. A sound selection strategy is one of the best ways to control bias in an experiment. Several aspects of this strategy may enhance validity and control bias. The use of objective selection criteria and sound recruitment methods are appropriate for all types of research. These should be some of the earliest decisions made about the study because objective selection criteria help minimize bias in both qualitative and quantitative studies. The sampling strategy for a qualitative study has a different goal than for a quantitative research. In turn, the sampling procedures for these two types of studies can be quite different. In the case of qualitative research, the goal is credibility rather than generalizability. So selection methods are purposeful. That comes from Fawcett and Garrity of 2009. Please make sure you're citing your sources. Thank you very much. This approach makes the sampling strategy less complicated for qualitative studies, but no less thoughtful. Careful attention to selection criteria can help minimize the effects of both researcher bias and selection bias in a qualitative study. That's from Creswell, 2008. For quantitative studies, the use of probability in sample selection or group assignment reduces bias and enhances the representativeness. There it is again. Representativeness of the results. Oh my, I can't talk tonight. Representativeness of the results. That's from NUR of 2009. In addition, subjects are recruited and selected for the study based on criteria that is carefully considered to represent the population under study while minimizing the effects of extraneous variables. The criteria are applied objectively, and all subjects who meet the criteria are generally invited to participate. Objective selection criteria may consist of inclusion criteria, exclusion criteria, or both. The use of inclusion criteria provides guidelines for choosing subjects who match a predetermined set of characteristics. These criteria define the major factors that are important to the research question and may include clinical, demographic, geographic, and temporal criteria as appropriate. The primary function of inclusion criteria is to limit the potential for selection bias by objectively identifying who can be considered a subject. Inclusion criteria. Guidelines for choosing subjects with a set of characteristics that include major factors important to the research question. Exclusion criteria. Characteristics that eliminate a potential subject from the study to avoid extraneous effects. Many authors also include exclusion criteria, meaning characteristics that are used to exclude a potential subject from the study. Some individuals are not suitable for the study, even though they may meet the inclusion criteria. These subjects might meet clinical exclusion criteria, for example, comorbid conditions that might affect the study, or behavioral exclusion criteria, for example, high likelihood of being lost to follow up. Exclusion criteria fulfill the same functions as inclusion criteria and help to control extraneous variables. Sampling in qualitative studies. Although objective criteria for recruitment and selection strengthen the credibility of a qualitative study, informants in this type of research are selected from the potential pool of subjects in a way that is controlled and executed by the researcher. This purposeful selection has as its aim the selection of subjects most likely to inform the research question. Criteria for selection of informants often look quite different for a qualitative study than for a quantitative one. Qualitative selection criteria may include requirements that an individual has experienced a phenomenon, possesses a particular attribute, or even expresses a willingness to talk openly about sensitive issues. Qualitative selection criteria are formulated through a thoughtful reflection on the type of individual who is most likely to inform the research question. The researcher then seeks out these individuals and invites them to participate in the study. Figure 7.1 depicts the general purpose of a sampling strategy. Purposeful selection, a technique used in qualitative research in which the subjects are selected because they possess certain characteristics that enhance the credibility of the study. A purposeful sample is in some ways easier to procure than a probabilistic one. Probabilistic one. But that does not imply the process is not systematic. A variety of techniques can be employed to achieve a purposeful sample, and each is appropriate under specific conditions to meet research objectives. Snowball sampling, also known as referral sampling, violates many principles of quantitative research but is commonly used to generate qualitative samples. This type of network sample, in which early respondents are essentially asked to recruit subsequent subjects, is particularly appropriate when studying social structures and interpersonal relationships. That's from Buddha of 2012. Sampling in quantitative studies. Quantitative samples have the best generalizability when they are selected and assigned to groups randomly. These are often referred to as probability samples. In quantitative studies, the development and use of inclusion and exclusion criteria are only the first steps in a highly controlled, objective selection strategy. The goal of quantitative studies is the representation of the population, and the use of probability in sample selection or group assignment helps the researcher achieve this goal. Levy, 2009. Probability sampling, also called random sampling, refers to a sampling process in which every member of the available population has an equal probability of being selected for the sample. A sample that is drawn randomly will represent the characteristics of the population and can be used to draw conclusions about the larger group, even when the entire population cannot be included. From NUR, 2009. Figure 7.2 depicts the general steps for quantitative sampling strategy. Probability or random sampling, a sampling process used in quantitative research in which every member of the available population has an equal chance of being selected for the sample. The only way to be sure a sample represents a population is if it incorporates two essential criteria. Each member of the population has an equal probability of selection for the sample, and each subject selection is an independent event. A random sample is one in which mathematical probability is used to ensure that selection of subjects is completely objective, a method called random selection. Independence is ensured when the selection of one subject has no effect on the selection of other subjects. In other words, each member of the population has exactly the same chance of being in the sample, and the selection of one subject has no influence on the selection of another. For example, if a subject was asked to recruit his or her friends and family members for the study, the assumption of the independence has been violated. Randomness and independence are central to ensuring that a sample is representative of the population, and both are also underlying assumptions of most inferential statistical tests. Random selection, a method of choosing a random sample using mathematical probability to ensure the selection of subjects is completely objective. Independence, a condition that occurs when the selection of one subject has no influence on the selection of other subjects. Each member of the population has exactly the same chance of being in the sample. The strongest evidence is produced by quantitative studies conducted with samples that are either randomly selected or randomly assigned to experimental groups. A researcher might have no choice except to ask accessibility subjects to join the study, and so potentially introduce bias. If the researcher randomly assigns the subjects to the experimental groups, however, then any differences between the samples and the population will be eventually evenly spread out over all groups in the experiment. Random sampling and assignment random sampling and assignment do not have to be complicated processes. Several types of random samples meet the essential criteria of both probability and independence. Simple random sampling. Simple random sampling is used when a table of random numbers, either from a textbook or generated by a computer program, is used to select subjects from the sampling frame. The sampling frame includes the entire population and is eligible for the study. The researcher must have access to a listing of all eligible individuals who both are part of the population and meet the selection criteria. The subjects are then numbered, random numbers are drawn, and the subjects with the drawn numbers are asked to participate in the study. For example, the drawn set of random numbers 21, 11, 143, 86 means that the 21st, the 11th, the 143rd, and the 86th subjects on the list would be asked to participate in the study. Common statistical tests generally include a table of random numbers as an appendix that can be used as part of a manual process. Most spreadsheet programs can generate a list of random numbers, and statistical software can automatically select a simple random sample from an imported list of potential subjects. To draw a simple random sample from a population, the researcher must have access to a list of individuals who are in the population. However, access to a listing of the entire sampling frame is rarely available to the researcher. For example, how would a researcher get a list of all people with hypertension, all nurse managers who work in critical care units, all adolescents who are sexually active? In addition to these logistical problems, most researchers do not have unlimited access to the population. If nothing else, most studies are limited by geography or availability of resources. In these cases, other varieties of random samples that do not require access to a list of the sampling frame may be more efficient and feasible. Systematic random sampling. Systematic random sampling is useful when the researcher is unsure how many individuals will eventually be in the population or when there is an indefinite sampling frame. It is also a practical way to draw a sample from the prospective group. That is, a group that will be created in the future. In systematic random sampling, the first subject is drawn randomly and remaining subjects are selected at predetermined intervals. For example, if a researcher needed a 10% random sample from the visitors to the emergency department over 12 months, the researcher might select the random number of 6 from the table of random numbers. In this case, once the study begun, the researcher would invite the 6th visitor to the emergency department and every 10th visitor after that. Systematic random sampling does not produce a strict probability sample, but for all practical purposes, it is usually just a good method. If it has an advantage that it is a relatively uncomplicated way to draw a representative sample. Stratified random sample. Today's cup. Today's cup is I love my edamame. Maybe if you're struggling, it could be extra credit. Maybe for those who watch. So if you do watch, just tell me that you know which cup I am drinking from. It may just be kudos. It may be extra credit. So, stratified random sampling. Stratified random samples are structured so that important characteristics are evenly distributed across all groups. Such sampling is a good way to reduce the probability that a subgroup will be underrepresented or overrepresented in some way. Stratification based on some important characteristics help ensure that all subgroups are represented in proportion to their prevalence in the defined population. Stratified random samples are more difficult to accomplish than simple or systematic random samples and involve two steps. The researcher first divides the population into groups based on some characteristics, for example, gender, ethnicity, and diagnoses, and then picks a representative sample from each group. Often a proportion from each subgroup is predetermined and is used to control a potential extraneous variable. For example, in a study of community-acquired pneumonia, the researcher might want to ensure that non-smokers and smokers are represented in the sample in the same proportion as they appear in the general population. If the population had a 17% smoking rate, then the researcher would first identify the smokers and non-smokers in the sample frame and randomly select subjects from each group so that the sample had 83% non-smokers and 17% smokers. Cluster random sampling. Sometimes it is impossible to draw single subjects from groups because of either their geographic limitations or accessibility issues. In cluster sampling, the researcher randomly selects entire groups and then randomly selects subjects from only those groups. For example, an organizational researcher might want to study the effect of care delivery modules on patient satisfaction among magnet facilities. Instead of randomly selecting from all patient care units in all magnet facilities, the researcher would first randomly select magnet facilities and then solicit participation from all the units in those facilities. Cluster random sampling is useful when subjects naturally fall into groups, schools, hospitals, and counties, because it is both relatively uncomplicated and efficient. That's from Rose and Bowen, 2009. Ensuring independence. Independence, the second criterion for a probability sample, is a statistical concern rather than an issue deriving from representation. Independence is violated if subjects are related in some way or if more than one score is collected from the same subject. It would be expected that subjects who are not independent would share some characteristic. When data are not independent, then the score on one measure shares some characteristic with the score on another measure. As a consequence, the results might be correlated in a way that is unrelated to the study. When data are not independent, then the score on one measure shares some characteristics with the score on another measure. I'm sorry if I repeated myself. It was on pause for a second. So as consequence, the results might be correlated in a way that is unrelated to the study. The most common non-independent sample is the pretest, post-test design. Time series data, meaning data collected on the same sample over time, are also non-independent. A researcher can compensate for non-independence with specific statistical tests, but the non-independent nature of the data must be recognized and dealt with. The most common sample, convenience sampling. When random sampling is not realistic, the researcher often relies on convenience sampling. Convenience sampling is based on subjects who are accessible to the researcher, sometimes called accidental sampling. Convenience samples have obvious advantages over probability samples, primarily with respect to logistics and cost. However, selection using convenience methods can introduce bias into the sample. Even greater potential for selection bias exists if the researcher is involved personally in selecting the subjects. Consciously or unconsciously, the researcher's predetermined ideas about the research might affect subject inclusion. Convenience sampling, a non-probability method of selecting a sample that includes subjects who are available conveniently to the researcher. A specific kind of convenience sample that violates both randomness and independence is snowball sampling, also called referral sampling. In snowball sampling, each subject is asked to recruit others. Although this may be the only way to reach some groups whose members possesses sensitive characteristics, alcoholics, drug addicts, or sexually active teens, the subjects are not independent and randomly selected, so the ability to generalize the results may be limited. Sadler et al. Of 2012 suggests that the weaknesses of snowball sampling can be compensated for in part by randomly selecting subjects from those referred via existing subjects. Snowball or referral sampling, a non-probability sampling method that relies on referrals from initial subjects to recruit additional subjects. Convenience sampling is often used in pilot studies when the specifics of a research study have yet to be completely determined. A small study conducted with a convenience sample can help guide the specifics for a larger study. In this situation, convenience sampling is acceptable and expected. However, even in pilot studies, when convenience sampling is necessary, the researchers should do as much as possible to limit the bias that is inherent in this sampling method. The best way to reduce bias in a convenience sample is to assign subjects to groups randomly once they have been recruited. A simple flip of a coin is considered a random event and can be used to assign subjects to groups. Using random assignment minimizes the bias of a convenience sample because extraneous variables are randomly spread over both groups. The most common sample, I don't believe we've talked about convenience sampling. When random sampling is not realistic, the researcher often relies on convenience sampling. Convenience sampling is based on subjects who are accessible to the researcher, sometimes called accidental sampling. Convenience samples have obvious advantages over probability samples, primarily with respect to logistics and cost. However, selection using convenience methods can introduce bias into the sample. Sampling methods for hard-to-reach populations. Some populations are inherently difficult to recruit. Members of those groups may avoid healthcare providers or come from a vulnerable or marginalized population. Subjects may fear legal or immigration consequences, be ashamed of their condition, or have difficulty reading or speaking English, or be compromised by addiction. These may be difficult populations to define and to access, yet they often have some of the most pressing healthcare needs that could benefit from evidence-based care. Sampling methods have been developed to compensate for these difficulties. Mixing methods. Mixing methods, some studies have as their goal the study of phenomena that do not occur frequently in lifespan or uncommon in general population. Good examples include the study of diseases in populations and the study of disaster response. At any given time, the chance of an individual having the condition is relatively small. Horney et al. 2012 demonstrated the effectiveness of combining strategies when the target is hard to reach by using a combination of cluster and referral sampling. They selected geographic areas, cluster sampling, and then asked respondents to identify others referral sampling in the area who had the condition. These kinds of combined methods may be the only practical alternatives for achieving both representativeness, that's that word again, representativeness, and a good response rate in the sample. Sampling and survey design. Recruiting subjects to answer surveys can be particularly difficult. In the case of survey sampling, an additional complexity is added. The response rate. Traditionally, the response rate is measured by dividing the total number of surveys distributed by the number who returned the survey. Additionally, the usable response rate is a third measure of importance. Of the surveys returned, how many were usable and complete? The response rate is important, but it reflects the degree to which representativeness of the population exists for the study and therefore indicates the generalizability of the results. This consideration is particularly important when assessing the use of survey results as evidence for practice. Other sample selection considerations. Although the subjects in this experiment are most likely to be people, that is not always the case. Populations and samples are not restricted to human beings. Subjects might refer to documents such as medical records, counties, or whole hospitals. In a particular kind of evidence-based research called meta-analysis, the subjects are actually research studies. When the study is something other than an individual human being, it is referred to as the unit of analysis. If a researcher wants to study the relationship between socioeconomic status and teen pregnancy rates in counties, for example, the researcher needs a sample made up of whole counties. In this case, the unit of analysis is a county. The unit of analysis may be groups of people, whole organizations, or cities. When the unit of analysis is quite large, then it becomes more difficult to recruit an adequate sample. For example, if the unit of analysis is a hospital and the researcher needs a sample size of 60, then 60 hospitals will have to be recruited for the study. Careful consideration of the unit of analysis involves thought about the difficulty of recruitment as well as the characteristics that are needed in the sample. Regardless of the unit of analysis, the sample should be selected based on preset criteria, using credible strategies. However, the sampling strategy is not of much use, no matter how well it is constructed, if an inadequate number of subjects agree to participate in the study. Sample size and power. How many subjects are in the sample? Although subject selection determines whether the results can be generalized to a larger population, the number of subjects in the sample affects whether the results can be trusted. Sample size influences the ability to detect significant findings and the level of confidence which we can incorporate results into practice and expect the same outcome. Sample size in qualitative studies. In qualitative studies, sample size is rarely predetermined. Although a researcher may have a general number of informants in mind, and although some standards have been set for particular kinds of qualitative studies such as phenomenology, criteria are generally not strict. Sample size for quantitative studies. In quantitative studies, the standard for determining sample size adequacy is power. Adequate power means there are enough subjects to detect a difference in the outcome variable. The calculation of power is a mathematical process and may be done either prospectively to determine how many subjects are needed or retrospectively to determine how much power a sample possessed. Reading the sample selection of a research study. The way a sample is selected allows for generalization of the results. The size of a sample allows trust in the results. Both are considerations when reading and evaluating the sample selection of a research study. A representative sample may not be trustworthy if it is too small, but even a large sample may not be applicable if it does not represent the population well. The most important considerations in evaluating a research sample are whether the sample is biased and whether the results can be trusted. Bias is minimized by the use of objective inclusion and exclusion criteria. Confidence in the results is based on an adequate sample size. When reading the sample selection of a research article, the NUR researcher should evaluate both sample selection methods and sample size. When critically reading a quantitative research study, ask the following questions to guide the evaluation of the sampling strategy. Were the subjects selected in an objective way? Was the sampling strategy applied consistently? Were the subjects assigned to treatment groups in an impartial manner? Were enough subjects included for you to be comfortable with the conclusions? When critically reading a qualitative research study, ask the following questions to guide the evaluation of the sampling strategy. Were criteria established for the characteristics that were desirable in informants? Did the researchers apply enough effort to find respondents who could best inform the question? Was saturation achieved and documented for a standard for sample size? Using research as evidence for practice. The sampling strategy is a key determinant of whether the research findings can be used in a specific patient care environment. The use of research as evidence for practice is based on studies that are well designed and that consider populations similar to the user's population. The appropriate use of research as evidence requires that the study possesses external validity. External validity is the link between finding knowledge through research and using that knowledge in practice. In other words, whether a research project can be used in a specific situation with a specific group of patients is a function of external validity. External validity refers to the ability to generalize the findings from a research study to other populations, places, and situations. It is essential for the transformation of research into evidence. External validity, the ability to generalize the findings from a research study to other populations, places, and situations. Creating an adequate sampling strategy. Although the sampling strategy is critical to ensure that the study findings will be applicable, it does not have to be complicated. The researcher can take many steps to ensure that the sample is as unbiased as possible, achieves maximum representation of the population, and is adequate to find statistical significance or achieve saturation. Most of these decisions are made during design of the study. Careful consideration of the sampling strategy is well worth the effort. Define the population. A clear definition of the population of interest, often called the target population, drives the sampling strategy. This definition may include clinical, demographic, or behavioral characteristics. The target population is the whole set of people to whom the results will be generalized, although it may be defined broadly. For example, all the people with type 2 diabetes, or more narrowly, all people with type 2 diabetes who were present to the emergency department with hyperglycemia. Create inclusion criteria. The inclusion criteria define the main characteristics of the desired population. The development of inclusion criteria often requires clinical judgment about which factors are mostly related to the research question. Inclusion criteria involve a trade-off between generalizability and efficiency. Very specifically designed inclusion criteria will limit those aspects available for the study. Very broad ones will increase the chance that extraneous variables are introduced. Develop exclusion criteria. Exclusion criteria indicate subjects who are not suitable for the research question. Thus, these criteria eliminate individuals from consideration in the study rather than identify them for recruitment. Such criteria may improve the efficiency, feasibility, and internal validity of a study at the expense of its generalizability, so they should be used sparingly. Exclusion criteria are generally clinical, certain comorbid conditions, or behavioral, a high risk of loss to follow up. Design a recruitment plan. Once the eligible population has been identified, a specific plan is needed to recruit subjects for the study. The goal of the recruitment are twofold: represent the population and recruit enough subjects to attain adequate power or saturation. Determine the number of subjects needed. The number of subjects needed for a qualitative study will be an emergent characteristic. As the study proceeds, an analytic method is generally used that involves continuously comparing results to those that have already been recorded. This method, called constant comparison, allows the researcher to evaluate when saturation has been achieved. That is, when no new information is being gathered. Applying the selection methodology. Once a potential sample has been recruited, then the specific selection methodology is used to identify the final participants. If a purposeful selection method is used for a qualitative study, the researcher invites participants directly from the eligible pool based on a judgment as to the credibility of each informant. Implement strategies to maximize retention. When an adequate number of acceptable subjects has been identified, recruited, and enrolled in a study, the researcher maintains an adequate sample through strategies that maximize retention. Subjects may move away, withdraw from personal reasons, or die during the course of the study. Attrition is particularly problematic in intervention studies and time series studies. Summary of key concepts. Sampling strategy is critical for application of research findings to a larger or different population. The way a sample is selected is major control for selection bias and is primary determinant of whether results from a sample can be generalized to a larger population. The goal of the sampling strategy for qualitative study is credibility and requires the researcher use judgment in the purposeful selection of individuals who can best inform the research question. Objective inclusion and exclusion criteria can reduce the potential for selection bias in any type of study. An element of randomness in sample selection for a quantitative study strengthens the potential for generalizability of the study results. If random selection is impossible, random assignments may evenly distribute population characteristics across all treatment groups. Random selection is possible through several methods, including simple random, systematic random, stratified random, and cluster random sampling methods. Other methods, such as respondent and service-driven sampling, may be necessary to enroll hard-to-reach or marginalized populations. In survey designs, a response rate of at least 50% is required to draw solid conclusions about the population. Sample size is an important consideration in determining the study's power or the ability to detect differences using a sample. Samples with at least 80% power are desirable. Power is a concern only if no statistically significant results were reported. If statistical significance was achieved, the sample had sufficient power. Several characteristics of the design and the population affect how much power a study has, including effect size, variability in primary outcome measures, and the level of certainty required. The criterion for a sample size in a qualitative study is saturation, which is the point at which no new information is being generated. The sampling strategy should be clearly described in a research study, along with a rationale for each sampling decision. It is the basis for trusting the results and applying them to specific patients. That concludes Week 4 lecture, NUR 410. I am your professor, Dr. Marion Johnson, and I will see you in Week 5. Let's participate. Thank you very much and have a wonderful week.